or atherosclerotic plaque. These are in the lumen of the blood vessel. In the vessel involved here, it is artery, not a vein. So in summary, atherosclerosis and atherosclerosis, they are different. One is the wall thickening and loss of elasticity, whereas the one is the deposit of atheromatous plaque in the lumen of the blood vessel. Atheromatous plaque is a region composed of soft lipid cores, cholesterol with necrotic debris. These are covered by a fibrous capsule. Epidemiologically, the atherosclerosis, most of the time it is found in developed countries, but even in low-income countries, you can find some atherosclerosis. There are some people disturbing us. Atherosclerosis, as I said, most of the time it is found in developed countries, but it doesn't mean in low-income countries there's no atherosclerosis. Let us see the pathogenesis. Pathogenesis, atherosclerosis produced by the following pathogenic events. First of all, there is endothelial injury. If you still remember the histology of the blood vessel. Endothelial injury, which can cause an increased vascular permeability, leukocyte adhesion, and thrombosis. Thrombosis, are going to see them. That formation of the blood clot. So there will be accumulation of the lipoproteins, mainly low-density lipoproteins. I hope you have done your biochemistry, high-density lipoprotein and apoproteins in your biochemistry. This one, they are also found in the case of atherosclerosis. Monocyte adhesion, monocyte here is like a macrophage to the endothelium. Then followed by migration into intima and transformation into macrophage and form cells. Those form macrophage. There will be also platelet adhesion. There are some factors listed from the activated platelet, macrophage, and the vascular wall cell, inducing smooth muscle recruitment, smooth muscle from the tunica media, either from the tunica media or from circulating precursors. There will be smooth muscle proliferation and extracellular matrix production. There will be also lipid accumulation, both extracellular and within the cell, the macrophage and the smooth muscle. In summary, this one is the beginning of the pathogenesis of the atherosclerosis, but it continues with the what we call fatty streaks. These are regions in atherosclerosis. They are composed of lipid-filled forming macrophages. Then there will be atherosclerotic plaque. In atherosclerosis, there are intimal thickening and lipid accumulation. Then atheromatous plaque. This one on the lumen of the artery, and the glossary appear white to yellow. This one it has thrombus on the illustrated red brown. The plaque may vary from 0.3 to 1.5 centimeter in diameter, but can coalesce to form large masses. This is the average. So what you must know here is atherosclerotic plaque have three principal components: cells, including smooth muscle cells, macrophage, T cell, then extracellular matrix, including collagen, elastic fibers, and proteoglycans, and intercellular and extracellular lipid. So, in summary, understand that in atherosclerosis, there is involvement of the endothelial cells, platelet, lipid, smooth muscle from the intima, and then there will be fatty streak at the beginning, atherosclerotic plaque, and at the end, atheromatous plaque. Let us see some images. Here you see the blood vessel. Here there is endothelium. Still remember story. The cell injury, which can be caused by hyperlipidemia, hypertension, smoking. Sorry?
Not showing the slide.
Sorry?
The image slide.
The image is not clear. Yeah, the image here is not clear, but if you want to see those images clearly, you can use that box of Robbins. Robbins.
The slide on pathogenesis.
Sorry?
The slide.
What?
Morning lecture.
Yes.
We were saying
The slide is not.
Yes, that's what you were saying. All the textbook of Robbins, if they probably gave it to our leaders like Sepe or Septin so that we can see it clearly later if now it can't be zoomed. Thank you.
I don't know the problem. What is the problem? What is the problem?
Yes. Yes, lecture. Me, I've just joined right now, but then the problem I found with my colleagues.
The problem of what?
The slide we are. The problem I'm seeing with my colleagues, I'm seeing like 3 semicircles.
Sorry?
Then on the left, I'm seeing 3 semicircles which are upside down. There is response to injury from level 1 to 2 and 3. But then the words on the left are somehow flu. So and then my colleague has just said probably when you related us to Robbins, we were inquiring if the textbook is or was given to our leaders, Sepe and Sepin, so that we can clearly know more.
Do you have Robbins' book?
Me, I don't have. In the group, it wasn't there.
Why don't you have the Robbins' book? I have shared with your leaders.
Okay, on the class email.
Ask your leaders, they have.
Thank you. We can continue.
I don't know why you work. I don't know. Because I have shared the Robbins from the beginning, and now some people, they told me you don't have Robbins. Because it is very big, it can't be uploaded to the Moodle. Ask Janet and the one from Mugako. Janet. Okay, we can continue. So for the injury to the endothelium can be caused by the hyperlipidemia. Most of the time it is hyperlipidemia. Because of most of the atherosclerosis, it is done because of those low density lipoproteins. Those accumulation, excessive accumulation of low density lipoproteins in the blood. It can be caused also by smoking, some toxins, some virus, some immune reaction. They can cause an injury to the endothelial cells. Then there will be levels to the injury. This one, there will be an increased permeability, leukocyte adhesion, where there will be also monocyte adhesion and the migration of those monocytes to the blood vessel wall. Then there will be involvement of the smooth muscle and recruitment of some macrophages. Here there is a macrophages. Here there is a lymphocyte. This one is fatty streak, where there's some fat, those lipids, those low density lipoproteins. Then there will be fibrofatty atheroma, and this one, lipid debris, some lymphocyte, a smooth muscle involvement in the extracellular matrix. Here we see an image where we see some of those low density lipoproteins, oxidized low density lipoproteins. Here there will be lipid, and here there's some foamy macrophages. Here there's an involvement of extracellular matrix, and here there's a proliferation of smooth muscle. And then here we see some migration of those smooth muscle cells from the blood vessel wall to the lumen of the blood vessel. And there will be some mediators like cytokines. And still remember that in histology, here it is the lumen, it is endothelium, intima, and then tunica media. Tunica media, it has smooth muscle. Then you see some migration of those smooth muscle entering in the lumen of the blood vessel. And here there is some leakage of those cholesterol to the lumen of the blood vessel. They say atherosclerotic plaque as a step to the following clinical important change. Atherosclerosis can cause rupture of the blood vessel, ulceration, and erosion of the intima surface of atheromatous plaque. Then exposed to the blood to the high thrombogenic substance and induce thrombosis. Thrombosis, the formation of clot. And such partial or complete occlude the lumen and lead to downstream ischemia. Ischemia meaning that there is diminution of the oxygen in the tissue. They say if the patient survives the initial thrombotic occlusion, the clot may become organized and incorporated into the growing plaque. Hemorrhage can be there into a plaque by rupture of the overlying fibrous capsule of that atheroma. Thin-walled vessels in the area of neovascularization. This can cause intraplaque hemorrhage and contain hematoma, which may spread to the plaque and induce plaque rupture. So in the summary, atherosclerosis, those atheromatous plaque, can cause rupture of the blood vessel and cause hemorrhage. There can be atheroembolism. Plaque rupture can discharge atherosclerotic debris into the bloodstream, producing the microemboli, meaning that that plaque of smooth muscle in the fat, this one can migrate to other organs like in the lung or the brain through the bloodstream. There can be aneurysm formation. Aneurysm formation means that there's dilatation, abnormal dilatation of the blood vessels. Atherosclerosis induced pressure or ischemic atrophy of the underlying media with loss of elastic tissue. This one can cause weakness, resulting in aneurysm dilatation and the protein rupture. So in the case of the aneurysm, there is abnormal dilatation of the blood due to the loss of that elasticity. And the main problem of the aneurysm, it can cause rupture of the blood vessel. And when it is for aortic, this one it is immediate death. Atherosclerotic stenosis. In small artery, atherosclerosis plaque can gradually occlude blood vessel and comprising flow and causing ischemic injury and lead to dry gangrene. That critical stenosis most of the time is found in the coronary artery in the heart. This typically occurs at the approximately of 7% of fixed occlusion. For this one, when it is in the coronary artery, it is very, very dangerous. It can cause some cardiac disease. We are going to see them. Apart from that coronary artery, can go also for mesenteric occlusion in intestine. This one with the bowel ischemia. There will be also a chronic ischemic heart disease in the coronary artery, ischemic encephalopathy when it is in the intermittent claudication in the lower limb. The effect of vascular occlusion ultimately depends on the arterial supply and the metabolic demand of the affected tissue, meaning that the atherosclerosis can be done on the coronary artery, mesenteric artery, and then it can also be in the lower limb, be intermittent claudication. It can also be found in the brain. Here it is an image with histologic features of atherosclerosis plaque in the coronary artery. Here it is in the wall of the coronary artery. Here you see this one yellow is fat. For this one small image, this one the rumen. This one is the fatty streak. Here it is clear. We see atherosclerotic plaque rupture. This one is in case of rupture. You see there's some hemorrhage. And this one you see that atherosclerotic plaque obstructing the lumen of the artery. Meaning that, if you remember physics, once the surface is reduced, the pressure will be increased. This is why, in the case of atherosclerosis, there will be arterial hypertension. In this one, it is in the case of rupture, there is hemorrhage. If you still remember your anatomy, these are coronary artery in the heart. Here it is those atherosclerotic plaque. You see some fat here in the lumen of the blood vessel. This one will be consequence that there will be arterial hypertension. It is an image of atherosclerosis with blood clot. Here there's some like a stenosis, and here there's a kind of spasm. In the case of atherosclerosis in coronary, there will be what coronary artery disease. There will be chest pain, shortness of breath, and then at the end there will be what we call heart attack. When an attack to your heart muscle becomes completely blocked, and the part of your heart muscle fed by the artery dies, meaning that once the coronary artery is blocked, there will be no blood in the heart tissue. Consequently, there will be death. So at the beginning, there's chest pain because the coronary arteries can't supply enough blood to meet the oxygen demand of your heart. And then there will be chest pain known as angina. Some people, they're not aware that they have the coronary artery disease until they develop symptoms. Those atherosclerosis, diabetes, they are called silent killer. Most of the time, we are not aware that we have those coronary artery disease until we develop some symptoms like those chest pain, shortness of the breath, swelling in the feet and ankles. This is an image of that atherosclerosis in coronary artery. The causes of atherosclerosis can be high blood cholesterol, raised blood level of low density lipoprotein, high blood pressure, and also the atherosclerosis also can induce high blood pressure, smoking, obesity, and the lack of physical activities. So, are you on high risk of developing atherosclerosis?
No.
Yes.
No.
Yes. The high blood pressure, it is an injury to the endothelial cells. And this one, once there is endothelial injury, this one there will be permeability of the arterial wall. And this one there will be, can cause migration of the smooth muscle into the lumen of the blood vessel. And in that case, when there is fat, excessive, low dust in lipoproteins, there will be accumulation of those fat and smooth muscle in the lumen. Then there will be atheromatous plaque. Consequently, there will be atherosclerosis. Okay. Smoking, obesity, lack of physical activities, those are also risk factors of atherosclerosis. But the most common is obesity, because in the case of obesity, there is high blood cholesterol and low density lipoprotein and excessive lipid in the blood stream. Physical exercise, this one will reduce that volume of the fat because there will be discharge of energy. So there will be no deposit of those cholesterol in the bloodstream. Some risk factors there is the constitutional risk factors like sex, hereditary, race, and age. The one who can be modifiable, there's high blood pressure, which can cause ischemic heart disease, hyperlipidemia, tobacco, inflammation, hemocystinemia, factors of hemostasis, we'll see them in thrombosis, lack of physical activities, obesity, diabetes, stress, and anger. Stress also is involved in atherosclerosis. But about the sex, it is most found in male than female. Yes?
Question.
Welcome.
How the anger can cause atherosclerosis?
Those anger and stress, most of the time, they induce immunological disease, and also they increase the pressure, high blood pressure. That high blood pressure can make an injury to the endothelial cells. So what you must know, stress and anger, they increase immunological disease and high blood pressure. So meaning that a permanent stress, it doesn't mean a stress of 1 minute or 2 minutes will cause atherosclerosis. This one, it must be a permanent stress.
Question.
Permanent anger of 1 minute will not cause atherosclerosis. But when it is anger for 5 years, meaning that if your working hours are 8 and you have anger 3 hours to 5 hours every day, so this one, it will be harmful to your life.
Question.
Mm-hmm.
What is the meaning of hyperhemocystinemia and how can it lead to atherosclerosis?
Hemocystinemia, we see them in your biochemistry. It is a chemical product. Which one it is involved in the high blood pressure and the diabetes? You will see them again in your biochemistry. It is known to affect the arterial blood wall. It is in relationship. Statistically, atherosclerosis is most found in male than female. There is no clear explanation about male and female, and as you know, it can cause a wrong discussion. And it will be a topic on social media. So the difference, the cause is not clear, but on the statistic, we found that atherosclerosis is most found in male and female. Okay.
Another small question.
Yes.
Thank you. Because atherosclerosis is a silent killer, but then it is both in male and female. Is it generally killing?
Killing.
Thank you. Yeah, they're both genders.
Once there is a total occlusion of those coronary arteries, what will be the consequence? Total obstruction of the coronary artery.
Yes, there will be total disease in both genders. That means atherosclerosis is similar. It can attack both genders same way.
I don't want to go into those discussion of male and female because they can create some conflict for nothing. Okay. What you must know, atherosclerosis is found in both male and female. Okay.
Yes.
Because if you go into those difference between the male and the female, it will create a long discussion. So for the prevention of atherosclerosis, get regular medical checkup to see those low density lipoproteins, to see your blood pressure, level of the cholesterol. Don't smoke, physical exercise, maintain your health weight, eat health diet, and manage your stress. And the atherosclerosis can cause what we call a stroke in the brain. We are going to see them in the case of the thrombosis. Once there is those migration of traumatized plaque or obstruction of the some vessels, this one can cause a stroke. Let us see what we call shock. A shock is characterized by systemic hypotension due to either reduced cardiac output or reduced effective circulating blood volume. So the consequences are impaired tissue, perfusion, and cellular hypoxia. At the outset of the cellular injury, this one it is reversible. However, prolonged shock eventually lead to irreversible tissue injury, which can lead to death. So in shock, there is hypotension due to the cardiac output or reduced circulating blood volume. The type of shock, there's cardiogenic shock. This one can due to intrinsic myocardial damage, infarction. We're going to see that what is the infarction. Ventricular arrhythmia. In the pulmonary examples are pulmonary embolism. Hypovolemic shock, another type of shock. This one is low cardiac output due to the loss of blood or plasma volume. For example, in the case of severe burns or in the case of accident, when there is rupture of some blood vessels, this one can cause hypovolemic shock. A septic shock, this one is that from vasodilatation and the peripheral pooling of blood as part of systemic immune reaction to bacterial or fungal infection, meaning that in the case of septic shock, there is involvement of those bacterial and fungal infection. Another shock, but less common, that shock can occur in the setting of anesthetic accident or spinal cord injury, is what we call neurogenic shock. You will see in your clinical practice, those people with neck injury, normally it must be immobilized because once you do some mobilization, there will be rupture of the spinal cord and immediately there will be death. This is what we call neurogenic shock. can also occur in case of the anesthesia. Another type of shock.
Teacher,
Yes.
on the previous slide about the septic shock, you say that the septic shock will result to the infections or fungal. I want to know if it is the shock which result to the infection or it is that infections that result to the shock.
This is a septic shock, and you have to understand the definition of the shock. There will be hypotension.
I know it.
Due to reduced cardiac output or circulating volume. For this one, in septic shock, there will be an inflammation. An inflammation, which will be a systemic inflammation, which can be either in the lung, kidney, liver, and the other part of the body, even the intestine. And for this one, there will be some cell death. In that case, there will be reduction of the blood volume. Okay.
Yes, lecturer. Is that the split be necrosis or apoptosis?
Sorry? Sorry?
The cell death that will occur at that moment of the infection, my colleague has said. Will it be apoptosis or necrosis?
This one is not apoptosis, it will be a necrosis.
All right.
And what
So,
you must know, it can be reversible or irreversible. When it is reversible, there is death. But once you treat those bacterial and fungal infection, it can be reversible.
So the reversible in cell death, it's necrosis.
Once there is necrosis, it is irreversible.
That's why it is a passive process. There is no energy.
Sorry?
That's why necrosis, I was saying, is that why necrosis is a passive process?
Is a part of what?
Is a passive, like no energy is needed because it's reversible.
Suppose you have the infection, some bacterial infection like a TB, other things, or Klebsiella like that. Once there's a treatment, a proper treatment of those Klebsiella,
yes.
So in that case, there will be no death of cells. But once there is no proper treatment, this one will lead to a cell death.
Okay. The proper treatment, like the medicine, we study in pharmacology and clinical chemistry.
Okay.
Thank you.
So another shock is anaphylactic shock. This one is the systemic vasodilatation and decreased vascular permeability. This one in the hospital, you will see some anaphylactic shock for injection of the penicillin. Those people who are allergic for penicillin, once you inject the penicillin, there will be anaphylactic shock. So on the examination, there will be an increase of IgE, and there will be an increase of the eosinophilia. And to treat that anaphylactic shock, immediately you have to inject the adrenaline if you have done your pharmacology. So in hospital anaphylactic shock, the most common is an injection of the penicillin. This one causes an anaphylactic shock. For those in the community, you see those people injured by bees. This one is the cause of anaphylactic shock.
Question.
So, yes.
Teacher, we've seen that the shock is due to the less cardiac output or the low volume of the circulating blood. So I want to know the relationship between shock and anemia.
Anemia is the diminution of what? Blood and
Oh, it's blood and the iron in the blood. The heme tissue.
only blood. So shock is the diminution of the blood volume.
Oh, okay.
Anemia is related to the hemoglobin, meaning that you can have an accident, there will be hypovolemic shock. For this one, if you want to treat that hypovolemic shock, you give a total blood. Whereas in the case of anemia, you give only red packed blood cells, because what is missing there is to collect the hemoglobin, not the volume. You understand? You can have
Yes.
hypovolemic shock, whereas the hemoglobin is
low.
yes, or normal. So this is why the missing is the total blood volume, whereas in the anemia it is only on the red blood cells. Okay.
Yeah.
Another question.
Hmm?
So if shock is the diminution of blood volume, so isn't there like trauma? Is there, for example, if it is psychological, is there any shock that can be probably psyche is our head, like our thinking? Are there only cardiac shocks during the heart or blood, or there are also some other types of shock?
I don't understand clear the question.
Yeah, okay, lecturer, you have just said that shock is the diminution of blood volume. Probably that's related to hemoglobin. But isn't there another type of shock?
No. Shock
Okay.
is not related to the hemoglobin. It is the total blood volume. Hemoglobin is for red blood cells.
Thank you.
Is it clear?
Yes.
In the anemia, we measure hemoglobin level. Okay. In the case of shock, we measure the
Blood volume.
We are going to see the sign of the shock. So this one you have seen. In the hypovolemic shock, the patient presents with the hypotension, weak and rapid pulse, tachypnea, clammy and cyanotic skin. Cyanotic because it becomes blue because of the lack of the oxygen. In the septic shock, the skin may initially be warm and flushed because of peripheral vasodilation. The septic shock is most frequently triggered by gram-positive bacteria, followed by gram-negative bacteria and fungi. So normally they say it is as endotoxic shock. So don't confuse shock and anemia. You can have anemia without hypotension.
Yes, doctor.
And in case of the anemia, some mucosa conjunctiva or oral mucosa, they are pale, they are whitish.
Question lecture.
But it can be combined in clinical practice. It doesn't mean what you see is different. It doesn't mean that a patient can have a shock on the same time have anemia. You will see it in your clinical practice. A question?
Yes, question. How septic and anaphylactic shock leads to hypotension?
They reduce what? They reduce the blood volume, meaning that in anaphylactic shock, they can have an obstruction of the blood vessel. This will be the main cause. There will be obstruction of the blood vessel. And this one will cause hypotension. In the hypoperfusion,
You are saying that when blood reduces, hypotension, the
Sorry?
mucosa.
Sorry?
Yes, sir. I was saying, you have told us that when blood reduces, that's a, but then the mucosa of the blood vessels, the top tissue, is going to be whitish. Yet, to be cyanotic is because there is lack of oxygen.
I don't understand clearly the question.
Excuse me, sir, I've come.
Can you repeat the
Sorry.
question?
Yes, thank you. I had internet issues. And then I was talking about the decrease and increase of blood volume. Yet the mucosa is still is whitish. So the blood inside flowing through the blood vessels.
No, don't have a confusion.
Okay.
In your clinical skills, don't bring those anemia here in the case of shock.
Wow.
You have it again in your clinical skills. Because if we go in the anemia, we lose the focus of the shock. Okay?
Okay.
Okay. So, in case of septic shock, there will be hypoperfusion, dysfunctional multiple organ, and culminating in the extraordinary morbidity and mortality associated with the sepsis. A sepsis will be systemic. Sepsis in the brain, sepsis in the kidney, sepsis in the lung, everywhere. And this one will cause a death. This one is not necessary. The main factor leading to that septic shock is an inflammatory mediators. Various microbial cell wall constituent engage the receptors on neutrophils, mononuclear inflammatory cells, the epithelial cells, leading to cellular activation. Here they say that involvement of those inflammatory in the case of inflammatory cells in the case of sepsis. In case of sepsis, there will be also endothelial cell activation, as we have seen last time in inflammation. Then there will be three major sequelae in the case of sepsis. There will be thrombosis, formation of the blood clot, increased vascular permeability, and vasodilation. The derangement of the coagulation is sufficient to produce fearsome complication. DIC is disseminated intravascular coagulation. This one you see it in your hematology. Most of the time it is caused by defect in effect of the factors of coagulation. They say sepsis may exhibit insulin resistance and hyperglycemia. They say cytokines such as tumor necrotic factor interleukin-1. They stress-induced some hormone like glucagon, glucocorticoid, catecholamine, and then all will drive glycogenosis. So they say that sepsis can promote insulin resistance via the release of pro-inflammatory skins that suppress insulin release, and thus promoting the insulin resistance in the liver and other tissue. It will cause also immunosuppression. There will be organ dysfunction due to that systemic hypotension. Then there will be interstitial edema, small vessel thrombosis, or will decrease the delivery of oxygen and nutrient to the tissue. This one is not necessary. Stage of shock can be an initial non-progressive, during which reflex compensatory mechanisms are activated and the perfusion of the vital organs is maintained, meaning that here it is corrected immediately. Progressive stage, it is by tissue perfusion, onset worsening circulatory, and metabolic imbalance, including acidosis. In this one, progress, it will go to the irreversible stage where the body has incurred cellular and tissue injury, so severe that even if the hemodynamic defects are corrected, survival is not possible. In this one, it is in the case of death, and it is a reversible injury, meaning that you can have a shock and immediately you can correct it. For example, if it is in the case of accident, there is rupture of the blood vessel, immediately you can perfuse a total blood and you correct that shock. Even if it is septic, there is a shock, but you can give a proper treatment. But once there is a proper treatment, this one can release and lead to the systemic organ dysfunction. And In that case, there will be death. So, concerning the atherosclerosis and the shock, these are some exercises to be done on yourself. So, any question before we go to break?
No other
Yes.
question.
I have a question.
Other question? So
I have a
we
question.
can have, yes. Question?
About slide number 17, I want to ask the causes of spasm.
The cause of that spasm.
Yes.
It was due to that obstruction of the coronary artery.
How is it different from atherosclerosis?
Atherosclerosis is that process of having a fat, smooth muscle here. You see? And this one, once there will be more fat and involvement of the smooth muscle, there will be reduction of the cell wall. And here there's kind of like a stenosis. Okay? So for this one, because this one is very small, this one is very big, suppose the blood is from here. It is a kind of physics. And then this one, there will be delays of passing blood from here to here, because here the lumen is reduced. So on that case, there will be a spasm. It will be like a short contraction of that smooth muscle because of that stenosis of the lumen of the blood vessels caused by atherosclerosis. Okay?
Yes.
Okay, let us have a break of let us have a break of 15 minutes. Then we'll come with the thrombosis and the embolism. Okay?
Before teacher, sorry.
Yes.
Anna? Yeah, there's a term which is the arteriosclerosis. How is it differ from atherosclerosis?
It is at the beginning. Atherosclerosis, arteriosclerosis,
yes,
affecting the arterial wall thickening and the loss of elasticity. Whereas in the case of atherosclerosis, there is atheromatous plaque in the lumen of the blood vessel. It has cholesterol, other fat, macrophage, and smooth muscle. Whereas in the arteriosclerosis, it is just thickening and the loss of elasticity of the blood vessel.
yes.
Yes. This one is physics. It is not even biological. Even here it is clear. You see here the fat. This one was a total lumen of the blood vessel. Now there is accumulation of fat here. So the lumen, it is from here, and now this one is the lumen. Okay? And what you must know, from here there will be migration of those smooth muscle. Is it clear? You see even here, there is the lumen was from here to here. And now look at the lumen. Okay? There is immigration of that what? Smooth, those smooth muscle. Warrior, the wall of the artery. Itigabanyuka. Where there is migration of those smooth muscle. What is reduced? Yes. Yes.
Yes, doctor, you can have a break.
Okay. Resume.
Thank you.